everyone, my name is Annika Jensen, and today I'm going to be talking about hepatitis B. What is hepatitis B? Hepatitis B is an enveloped icosahedral DNA virus belonging to the Hepadnaeviridae family. Its genome is partially double-stranded and circular, and the virus measures approximately 42 to 47 nanometers in diameter. In the picture I have on the slide, it shows up close the hepatitis B virus. Disease description. Hepatitis B is a vaccine-preventable disease that causes acute and chronic liver inflammation. In acute infection, there is inflammation and damage to liver cells, including ballooning degeneration, apoptic bodies, and Kupffer cell activation. Chronic infection leads to chronic inflammation, fibrosis, and potential cirrhosis, increasing the risk of hepatocellular carcinoma. Symptoms include fatigue, loss of appetite, nausea, vomiting, abdominal pain, and joint pain. Some people may also experience a fever, dark urine, and yellowing of the skin and eyes, which is also known as jaundice. Many people don't experience any symptoms at all. The incubation period for hepatitis B is typically 60 to 150 days. In the top left corner, I have a picture of a hepatitis B vaccine. In the top right corner, I have a diagram with some symptoms of hepatitis B. The symptoms listed are fever, jaundice, dark urine, nausea and vomiting, pain in the right side of the abdomen, a headache, hives, joint pain, weakness or fatigue, and losing your appetite. Disease frequency. People in regions such as Asia, Africa, and Eastern Europe are the most susceptible to getting hepatitis B. China has the largest burden of hepatitis B worldwide, with 1/3 of global chronic HBV cases. Individuals at increased risk for hepatitis B infection include healthcare workers, people who inject drugs, infants born to mothers with hepatitis B, people with multiple sexual partners, and people who share needles or syringes. It's estimated that 254 million people were living with chronic hepatitis B infection in 2022. Approximately 1.5 million people become newly infected with hepatitis B each year. It was responsible for an estimated 1.1 million deaths worldwide in 2022. Liver cancer and cirrhosis are major causes of death related to hepatitis B. There was some progress in reducing hepatitis B-related deaths since 2013, but the progress has stalled in recent years. I have a picture in the corner here that shows where all hepatitis B is around the world. This was from 2005, and it shows who's at high risk, intermediate, and low risk. Source. Hepatitis B is spread through humans when someone is in contact with the blood, semen, or other body fluids of an infected person. Transmission. Hepatitis B is transmitted from person to person through infected body fluids. These include blood, saliva, vaginal fluids, and semen. It can also be passed from a mother to her baby during birth. Hepatitis B can be prevented with a safe and effective vaccine. This vaccine is usually given soon after birth to a baby, with boosters a few weeks later. Therapy. Several antiviral medications are used to treat hepatitis B. These include nucleotide analogs like entecavir and tenofovir, and immune modulator drugs like pegylated interferon. Nucleotide analogs are often preferred as a first-line treatment due to their efficiency and lower risk of resistance. Entecavir is a nucleoside analog that inhibits HBV replication. Tenofovir is also a nucleotide analog that inhibits HBV replication. Pegylated interferon works by stimulating the immune system to fight the virus and is often used in combination with other medications. The most common vaccine used for hepatitis B is a recombinant vaccine that contains a hepatitis B surface antigen protein. This vaccine does not contain live virus or potentially other harmful substances. It works by stimulating the body to produce antibodies against HBsAg, which then provides protection against a real hepatitis B infection. The vaccine is designed to provide long-term protection. Most people who receive the full vaccination series develop strong immunity that lasts for decades. A booster dose is not usually recommended. Tests. Blood tests are a common laboratory testing method for diagnosing hepatitis B. The presence of the total anti-HBC antigen is needed to diagnose a patient with the hepatitis B infection. The results of the HBsAg anti-HBs and IgM anti-HBC tests indicate a patient's type of hepatitis and if they have developed immunity. In the picture shown, I have someone that's getting a blood test to see if they have hepatitis B. New data. The latest national survey conducted in 2020 revealed that 75 million cases of chronic HBV infection exist in China. According to recent international model estimations, the prevalence of HBsAg in China was expected to reach approximately 5% by 2024, approaching the level of a lower intermediate endemic area. In the diagram shown, it shows the number of cases in the age groups of hepatitis B. This was in 2018. Lastly, I have a list of my references that I used for this slideshow. Thank you all for listening.